So, welcome back everyone to the Caring Neurologist with Dr. Sandeep Thakkar. I do think that we've been talking about very interesting things. We have been receiving lots of messages. And this is my point of view, but I believe everyone's going to share it. Dr. Sandeep is not only a great neurologist, but a great human being. And I think that does change everything. A good doctor should also be a very good human being. And last episode, we talked about Botox. Remember, Dr. Takar?
Yeah, we touched upon it and its utility and how I use it with my patients. Trying to be a little bit more innovative as I can be for patients who can utilize it for muscle disorders.
Yeah, we did talk about the fact that I was kind of reluctant on Botox because it feels as if everyone is using it as cosmetic surgery. But you did say that Botox does change the lives of those suffering from Parkinson's. So let's set the stage to talk about Botox beyond beauty. And as I just told you, when people hear Botox, they immediately think of wrinkles and cosmetic procedures and fine lines. But in reality, you use it to treat movement disorders. So I want to know how you first discovered the power of Botox beyond aesthetics.
Yeah, and I want to claim like I'm not the first to utilize it. It's been utilized for people, kids, young adults, even elderly who have strabismus or with like a lazy eye or the eye's been kind of pulling in. So it was actually utilized very early on for such therapy where in the eye muscles, it was injected by a ophthalmologist to help reduce that lazy eye or that muscle that was pulled or pulling and causing contraction. So, one of the key things is Botox is one of the five main botulinum therapies that are actually available currently. So, I use Botox interchangeably as what we call botulinum therapy, but there's something called Xeomin, there's something called MyoBlock, Dysport, and Daxify. And these are all utilized for medical purposes as well as the utility for like relaxing contractions of muscles that cause wrinkles. But going back to where you started off with, how did I start utilizing it? A lot of my mentors and a lot of neurologists before me have used it for strokes, patients who've had spastic hands that, they got facial pulling, neck pulling, and they got the spastic hand. So we've been injecting botulinum therapies for years and decades to help reduce the muscle spasms. We've also used it for cervical dystonia, as we've talked about, where the neck kind of has a pull or it can spasm or it can tremor. Some people have some abnormalities, maybe whether they were pulled from birth and the birthing canal and they strained some of the neck muscles and some of the nerves that come to signal. So it's been used for many medical purposes for years before. But what I've been utilizing it has been for patients with Parkinson's who have difficulty with handwriting and shaking. One of the first symptoms that patients complain about with Parkinson's is that their handwriting gets smaller. And if you go back to episode 1, when we talked about symptoms of Parkinson's, slowness of movement, rigid muscles, well, people have small handwriting. We call it micrographia. So they don't really have good flexibility around their wrist. So I was early adopter of utilizing Botox to inject into the forearm muscles and certain muscles so that they can write and get their flexibility back, and so they can get back to fine work, whether it's writing, whether it's buttoning, but it helps relax these muscles that get tight from the disease state. And what's actually really interesting is I learned how to do this from my stroke patients who are obviously getting a lot of rigid muscles and contracted muscles. And then I started utilizing in golfers. Some golfers, they have the yips. They try to putt, and then all of a sudden they get this yip um, and these spasms. So as I learned how to utilize it for spasms, involuntary movements, then I started utilizing the injections for medical purposes of spasms that are, create a rhythmical tremor. So little by little, me and my team, including my physician assistants, we've all kind of figured out a way of injecting certain muscles so that people don't shake when they write, when they're holding a cup, for instance, they have a certain degree of tremor. have to always be careful how much coffee's in a cup or water. So whenever a person's shaking and they're shaking, they bring it close to their face and they're shaking, we look at the muscles and we can identify which muscles need to be injected so they can not shake when they need to, have the purposes of fluid drinking in social settings.
Dr. Thakkar, please forgive my lack of knowledge, but I need to understand what exactly Botox is doing in the body that makes it effective for movement disorders like tremors or dystonia or, I don't know, excessive eye blinking. What does it do exactly?
So as a medical purpose, right? The situation of it is to relax muscles. To an extreme, in like any medicine, if it's overused, it can create a problem of weakness or side effects that potentially could be like a microparalysis. So wherever you inject Botox, the medication basically comes into the muscle, works at the nerve level, and it reduces neurotransmitters that are causing a contraction. So basically, it relaxes the muscle so it's not as powerful of a contraction. So all it does is relax. One of the biggest things is, Botox comes from the term Clostridium botulinum toxin. So when a bacteria, where this substance is made from, is released naturally, like in food that's not properly cooked, it spreads into the food, and then when humans are to ingest it, then it can cause a paralysis for up to 3 months. And so what happens is, obviously, we relax the muscles, and you relax it too much, you get paralyzed. So what the medical community has done, and initially this was Allergan, now AbbVie, they have harvested small quantities so that we can use it as an injectable form and inject into muscles to relax it so it's not contracting. So it reduces that spasm of contraction, the power of the contraction to relax the muscles. So again, some people who've come in with the facial twitch, we inject around here to relax the muscle so the force of the contraction isn't as much. Or as we talked about with the neck, some people have cervical dystonia and we inject the muscles, now they're not in as much pain. And same thing goes with migraines. Many people around the world, right, are suffering from migraines and chronic migraines specifically, and we use Botox to inject around these muscles that create the tension that aggravate migraines.
Wow. Um, there is often skepticism around Botox in
Mhm.
medicine. Some people, not me, because now I've been talking to you, but some people assume it's just like a cosmetic luxury. Um, and I do think, I don't know, I'm thinking maybe you get a new Parkinson's patient and you tell them you're gonna use or utilize Botox and they kind of doubt its effectiveness in treating their condition. So, what would you say to someone who doubts the effectiveness of Botox in treating neurological conditions?
Well, I mean, it's a common misconception, right? It's like Botox is only for, cosmetics, or the other thought process is that, it's only for celebrities and it makes their face pull back or whatnot. And that's not what it does, right? It doesn't pull back any muscle. It just relaxes muscle. Those are fillers and kind of these other types of uh, surgical procedures that are used to, again, kind of pull back the skin. It doesn't make your lips puffy, and those are, again, going back to like different fats and fillers. Botox, again, totally relaxes the muscle. And so what I start off with the discussion with our patients who are completely naive to it is I go over the basics of Parkinson's, right? I say you have tremor, stiffness, slowness, and potentially balance issues. And the stiffness of the muscles create the slowness of coordination, or the stiffness of the muscles is causing the pull, and every time that you're tremoring is actually the muscle spasming. And so we go over the basics of what Parkinson's is so they can understand that I have a therapy that we can use that is specific and localized for those muscles. So when I say, I have a therapy that we use to inject into the muscles to relax it so it's not as tremulous, patients understand that. And then I go into details that actually this is what it is utilized. And to demystify those problems that patients have of of the term Botox, we talk about how it is utilized for overactive bladder as a medical purpose, how it is used for migraines, how it is, utilized for patients who've had strokes. And again, one of the other rare situations people don't know about is that people have very sweaty palms and sweaty feet. We even have something that's called hyperhidrosis. There's actually indication of Botox to reduce that unnecessary sweating palms and sweaty feet.
Okay, I'm trying to understand. I'm getting there. It's not gonna be easy, but I'll get there with your help,
Slow and
of
steady.
course. You are one of the few neurologists pioneering Botox for movement disorders. So, could you please walk? I was gonna say walk me, but it's walk us through how it is exactly that you use it in your practice, because this is the image I have of Botox. um I've never done it, but I know people who've done it. They go to like any medical consultation and they just like use a syringe and put it inside the wrinkle and then they leave. But how is it exactly that you used Botox?
Yeah, so I'm glad that we get to go into those type of details. So number one is ours, especially in our clinic. Patients come in and we're going over their normal exam. They're sitting comfortably, they're relaxed, and it just depends on where we're going to inject. So for patients who have forearm like hand shaking and tremors, right? So let's just say Michael J. Fox comes into my office, right, and he's shaking and he can't write well. So I'll have him again totally comfortable, totally relaxed, his hands just sitting on our bench, and he doesn't even have to like get any special anesthesia. We don't need to even necessarily put creams on the muscle because we use a very tiny little needle, 30 gauge needle. We drop the medication. One thing I always do is I always drop the medication in front of people because I want them to see the bottle, I want them to see how it's packaged, I want them to even I hand them the, we call it ISI packet. So it has all the information about the medication, and then they get to see what it is. And we draw it up in front of them. And there's a certain amount of units that we use. And that's what's made us unique, is that you can use Botox for any voluntary muscle or involuntary muscle of the body. But when it's for contractions for someone who has like Parkinson's or any sort of essential tremor, which is another major use that I inject, is that when we draw it up, we know which muscle has the certain amount that can be utilized. So not every muscle gets the same amount because a smaller muscle needs a smaller quantity, and a larger muscle will need a larger amount of units. So we draw it up accordingly, and then we will find the muscle precisely. Now, there's different ways anatomically, or even I may use a special machine called a EMG guidance machine, electromyography, and that kind of gives me the signal that says this is the muscle. But after doing this for over a decade of injecting thousands of patients, we kind of understand the muscles pretty well. I actually even teach uh, for AbbVie and Allergan for their new hire trainers, just so that they can spread this knowledge to others.
Dr. Thakkar, I'm gonna ask a question that might sound really stupid, but I am going to ask it. So if what you're telling me is that Botox relaxes the muscle, what I could think is that if you have a cramp, you could use Botox. Is that so?
Yeah, so a lot of our patients suffer from cramps and pains from these muscle contractions. So if I go back to the Parkinson's world, what's unique is a lot of our patients with Parkinson's suffer cramps on their side of symptoms predominantly. Like let's say if it's the right side where they're tremoring, or their leg is trembling, the brain sends the signal to that side. It's always more active, and since it's always active, which is what makes it a disease state, is that we see these patients complain of cramping and painful cramping also, that wakes them up at night numerous times. I mean, patients are actually taking the wrong medicines for that. And we prescribe and have been taught for years, take a muscle relaxer, which is a tablet that is really actually used for post-surgical use, for like back pain after a surgery. But we use these muscle relaxers that make people sleepy and tired, and they take it at night and then they wake up and they walk into the bathroom and they fall. And this is where they get complications. So the main purpose of Botox, in my opinion, is utilizing it as a tool that is effective and localized to where the muscles are causing problems. So we inject into the calf muscle, the gastroc muscle that causes the foot cramps, the hamstring muscles that causes those irritable issues for patients at night. And now they're not suffering from those terrible symptoms. So we utilize it again for so many specific situations, but every 3 months, patients come in for these injections. And again, it takes about a week or two for it to kick in. And as it sustains and gets this benefit, it maintains for about 8 to 10 weeks and it drops off at that 11, 12 week mark. So that's why a lot of our patients come in every 12 weeks for these injections at a minimum, so that again, these not only forceful cramps but forceful spasms are fully under control.
So I love stories. Let's talk about real patient impact. Is there a powerful success story of someone whose life actually changed because of Botox treatment?
You know, there's many stories that come about and that I think about, but one of the early adopters of why I wanted to utilize therapy is this one patient was she was 82 at the time, and she had what's called essential tremor, and her essential tremor was really bad that it runs in her family. Her mother had it, her sister has it, her mom's side of the family basically has been suffering, as well as even her daughter. And so she shakes with any action. Her jaw shakes, her head shakes, her hands shake. It affects her walking. So one of the biggest things, it was around Christmas time, and she said, I can't even write Christmas cards, and it's really bothering me. And I said, look, I've been able to inject the forearm muscles. We can help reduce the tremors. Maybe there's some improvement so you can feed yourself better. And she was a surgical candidate. She was ready for deep brain stimulation, but she's also scared because of complications, her age, the anesthesia. And, we went through all the protocols of it, and there were some risk factors for sure. She was also on blood thinners, so it was kind of this mindset of like maybe deep brain stimulation. She doesn't, she's concerned about a bleed in the brain. So we said, okay, look, I have an option before we actually go move forward for anything surgical. I have a procedure I could do. I can inject your forearm muscles. We can see if there's a reduction of the spasm, so you can maybe write again or start eating easier. So she said, okay, well, we'll give it a try. So it ends up being like 2 weeks later, I get a card in the mail. She sends it, and this is like, nowadays everything's always email, but when you get a card, it's always kind of unique. And I still actually have it in my office. And she wrote me a beautiful letter, and she wrote down that this is the first time that she's been able to write again. She's been able to write checks. She's been eating and drinking easier. Her penmanship was dramatically improved. And what we're able to see is that, I mean, it hit my like soul. I mean, it really made me think, like, if we're getting the ability to write, our ability to write again, and for her, it'd been almost 20 years since she wrote a card. So, that type of perspective, it really hits home that we can help people even early in the disease state, more advanced stages of it. Again, we're fortunate that Botox does what it's supposed to do, and it's unique. As long as you know how to inject and where to inject, it really helps the purpose of quality of life.
What astonishes me? How many things we take for granted, like writing, and how it can actually change somebody's life because they couldn't do it. They couldn't do something as like talking to you and writing something down because they didn't want to forget. And I guess sometimes we forget the power of the small things.
Yeah, and again, it's like, our everyday task, we can compensate until we can't compensate anymore, right? And so we shouldn't be struggling to compensate. And, there's a lot of patients that come in, they say, they can't write their name when they check in to an office, or, they can't type well, they keep double tapping or they're texting and they spasm up. And, it's harder for them to live their normal life. I think one of the biggest things, Ursula, is that we're all sociable people, right? We want to go out with friends and family. You know, I think Botox and the utility that we've been utilizing it medically has helped people feel like they can be around family and friends again. They're scared to go for dinner, they're scared to go for a lunch meeting. They don't want to socialize when there's a family event at a holiday party, whatever it is. Like, the shaking really interferes with their social status, and it's unfair. So again, I think it's the obvious and it's the not obvious, right? Like, how does it impact us in layers in our day?
Yeah, I hadn't thought about it, but I'm thinking for a lot of people, it is probably very embarrassing to know that they cannot control themselves. Um, this is wonderful, but I do need to ask if there are any side effects or misconceptions about Botox in neurology that you do think more patients should be aware of.
Yeah, you got to always keep fair balance. And, one of the things when I teach and lecture other doctors about medications or Botox, there's always the benefit and there's always the side effect profile. So number one is just like people can have a peanut allergy or not allergy, you don't know that you're going to have a reaction to something until you have it for the first time. There's not really a great way of saying and detecting who has a risk factor for an anaphylaxis or reaction where lips get swollen, or you get a rash, or you have respiratory issues. So with Botox, it is a muscle relaxer, very localized, specific, right? So again, if you are not a well-versed injector, and you're injecting into areas like, say, for the neck muscles when someone has migraines, or if someone's having cervical dystonia, if you're in the areas for respiration, there's a risk of having shortness of breath or problems with swallowing. So again, an experienced injector can avoid and minimize that. It is an injection that has to go into the muscle and not into the vessels, not into the arteries or veins, because we don't want it to spread. And so there's a way of injecting. And again, it is by those that are experienced. So it shouldn't be done by anyone who doesn't know how to do it. Again, my physician assistants are well trained, and our nurses are very well trained in injecting. So we do see that those who are experienced have the ability to minimize the risk factors of bruising, as well, wherever we're injecting. But as far as the misconceptions, again, it's not an everyday injection. This is once every 3 months. The sustained benefit, again, it relaxes muscle. Some people are concerned about paralysis, and again, everything that we utilize in Botox for it's temporary. So it's a temporary benefit of 3 months, and even the side effect profile, if it creates a weakness or relaxes the muscle too much where the hand grip isn't as strong, then we do see that minimizes and it restores back to normal. So Botox does what it does. It kicks in and it wears off very, very appropriately and timely manner.
This is me being curious because Botox makes much more sense to be utilized the way you talk about it than to be utilized for wrinkles. So I'm wondering, how did it begin? Was it first that it was discovered for wrinkles and fine lines, and then people like you realized that it was very good on Parkinson's patients or on other kinds of diseases? Or was it the other way around? How is the circle of Botox?
I don't know if I can correctly say like that circle of life of Botox of when it came about and how, but from my experience and those that I've talked with, it was utilized again early on for strabismus, for the eye movements and the spasms of the eyelid, um, and the eye muscles that cause the pulling and that lazy eye. So it was utilized early on for that as one of its first indications. I have some patients who were at the initial clinical studies 27 years ago for cervical dystonia. They went to UCSF for injections, and they still, even to this day, decades later, still utilizing this as a therapy for their neck. But again, it's like the thing that moves the bell is always cosmetics, right? The situation has been that it's been advertise easier for such situations. And so you would see it in magazines and whatnot. But for medical purposes, you don't get that advertising because it's not like for, and it's not like we advertise for Parkinson's medicines on a regular basis and things such as that. So when we utilize it for medicinal purposes, you would only see it at those offices that are actually utilizing it. So again, for people who go to neurologists for migraines, they'll bring it up. If you go to a urologist and you're having bladder urgency, then they may bring it up along the lines. For Parkinson's, again, it's going to be something that I think in the future it needs to be part of our training for all neurologists so that we can be able to inject accordingly for those who've had a stroke, those people who have, again, migraines, and again for Parkinson's, because any part of the body can shake with Parkinson's, right? We can see a lip tremor, we can see a head tremor, you can also see a foot tremor. Going back to stories again about like how people have been quality of life affected, had this one patient with Parkinson's. He was always anxious driving, and he, was having a tough time because his right foot was always tremor, whether he was trying to brake or when he's putting the foot on the accelerator, and he never felt comfortable driving, and he actually stopped driving for a time period. And we started talking about what's affecting his quality of life. He said, I wish I could, drive again. And again, Southern California, we don't walk around much. Everything's get in the car, move around here, there, and hustle and bustle, right? And so I explained to him, look, I have a way of relaxing the muscle so the tremor and the force of the tremor is less. And you could still walk well, if not walk better, and you can push off better. And so we injected, and within a week, he's back to driving again, comfortable. He's not feeling anxious. And when it wore off after the 3 months, he's like, I'm feeling nervous again. I can feel my leg being starting to spasm again. And so we repeat the cycle again every 3, even 4 months now, because it's sustained benefit. It gives that degree of utility that I don't think we should just stick to the guidelines of what the indications are. I mean, there's a lot of research being published for utility of Botox for other body parts.
You read my mind because I was gonna ask, what conditions outside Parkinson's can Botox treat in the neurology space? I mean, are there any surprising applications that most people do not know about? Is there anything that you're currently investigating? I mean, because from what I'm hearing from you, Botox is so much more than what people think.
Yeah, so I think we're living in a world right now where there's a lot of mental health issues, and there's issues that we're dealing with, um, stress. And so, number one is I know that the previous company before that was in charge of Botox, they were studying for anxiety, and they would inject certain muscles of the neck. It was to see if the anxiety or depression were reduced. But I think that if we can relax our tension in our neck, I mean, we all have tension in our neck. We all are on the computer. We're always texting in a certain way. I was looking at people on a plane. We were flying back from a vacation, and literally everyone's neck is in a certain position, right, because of the phone. And so, again, if we relax these muscles, I mean, I think we're going to see less chronic neck pain issues, less need for epidurals, less need for Tylenol and ibuprofen. I mean, I think the utility of Botox is for everyday purposes. But like, if you think about people who go for surgeries, I mean, think about like Tiger Woods, for instance. He's had countless back surgeries, and it affects the way he golfs. I mean, everyday issues of like people who have had back surgeries, these muscles get spasmodic, they get scar tissue. If we were to inject Botox into these muscles, we'll regain that flexibility. And that's what happens to a lot of people post surgery, whether it's the neck, whether it's the back, whether it's the arm. You develop these contracted states, and then now we've lost flexibility. So Botox could be used for post-surgical care. We have a friend who just recently had Achilles tear playing pickleball, and unfortunately, his foot was it's supposed to be like 90 degrees, right? But after the surgery, after they had to bring back the tendon of the Achilles, his foot's kind of flexed forward. So he's like kind of walking on his toes, and his heel can't hit the ground yet, but he has to go physical therapy for managing that. And it's painful, and it's really difficult for him. And if we were to utilize Botox in the muscles of the gastrocs and the calf muscles, and we relax those, now his flexibility is better. And so maybe he can heal faster. And so these are the type of things that I think Botox has this utility, for healing post-surgery, I think it's very useful for concussions. I mean, we think about football players, soccer players, boxers. After you've gotten hit with a concussion, the neck and muscles are all tense. We should be injecting in these muscles also to relax so that people can heal faster. I think there's countless purposes that aren't so obvious.
You talk about muscles being tense, and I immediately start feeling how tense I am. But you've pioneered Botox for tremors and for dystonia, which is the main thing we're talking about. Where do you see this treatment evolving in, say, the next 5 or 10 years?
Yeah, so I talked about essential tremor earlier. It's another tremor disorder that's mistaken for Parkinson's, and that outnumbers Parkinson's disease actually like 10 to 1. I mean, number one is that we are studying it for essential tremor, but the current protocol that's being used is not as great for the clinical studies. I think, utilizing someone like myself in helping the FDA get that approved, I think that would be unique because we have a certain treatment flow of muscles that we utilize at low amounts, and we're not wasting too much medicine. It'll be cheaper for patients. Um, but for essential tremor, I think anyone who shakes, we could potentially have any of these botulinum therapies as an option. That would again help mitigate the strong medicines that we use to calm down tremor. So first and foremost, I think essential tremor, and then with Parkinson's, it should be a standard of care for patients. I think looking in the future as well, I think post concussion therapy, I think that should be part of that. But I think we should be looking at it as again surgical options, post surgical care, corrective measures to get people faster to heal. I think that's where the utility comes into play.
Okay, this is me moving to La La Land, okay? So, if research funding was not an issue, which it is, of course, but let's imagine a world where research funding was not an issue. Um, and there were a lot of options. What groundbreaking innovation would you like to see in Botox treatment for movement disorders?
That's interesting. I mean, I already feel honestly that I'm utilizing it for as much as I can for patients. I mean, we have patients coming in from different states and even different countries just to get us to inject different muscles. I think, if we can have a better pathway of funding for studies, we would get it more available because we know what Botox does and we know the effect of it. We just need better standards to objectify and measure. But I think, again, when it comes to like funding, it's just really about companies saying, "Hey, you know what? We have an opportunity to help patients, and it shouldn't cost like millions of dollars to get a clinical study going." But I mean, I think we should just have it already as an indication for Parkinson's. I mean, honestly, it should be already there where insurances will cover it for handwriting specific issues for people so they can walk better, freezing of gait. Again, Parkinson's patients have this shuffling gait. We inject it for the gastroc muscles. I mean, we should be utilizing it early on. So as far as funding goes, I think we do a lot of wasteful spending anyway on certain clinical research. We need to really hone in on making people's quality of life better. And I think if we could have a streamlined approach for Botox for a disease state of Parkinson's, I think that would be useful. Now, I do want to comment though, when we are utilizing it for patients, again, we're utilizing it for medical purposes, what we call dystonia, hand-specific dystonia. When they spasm, when they write, we call it a dystonic tremor. I mean, we are utilizing it, but it shouldn't be so limited by certain classifications, you know? I mean, it should be open for the disease state. And again, I think that's where we have to have a better open mind.
Do you think, now that you're talking about open mind, do you think it would be helpful if regular people like myself, we hear about Botox all the time because you have friends who utilize Botox. Do you think it would be helpful if every time Botox is mentioned as a cosmetic thing, those who know about the effects on tremors and on dystonia and on Parkinson talk about it in a very easy way, like, hey, did you know that it can work as well for Parkinson patients?
Oh, I mean, ideally, that would be amazing if people could talk about it in that regard. In the circle of where we live, and where I practice in Orange County, at support groups, people already talk about it. We have people who come in now just to ask, "Can I come in for Botox for tremor?" So it is, in our area, very colloquial. I mean, it's a term that's used, Botox for medical therapy of tremor. So we have that already going in our part of the world. But I think, again, it should be more advocated, um, for in a medical purpose. And I did talk to some people from the company that are the makers of Botox, and their medicinal purposes and the money that is spent and gained from Botox for medicinal purposes is actually like 60%, 70% actually is for medication purposes, and the remaining is actually for cosmetics. So we are seeing that it is highly utilized, but the misconception is that it's only for cosmetics.
What can we do? What can any person do to start or to try to help you with your in this journey that is so inspiring?
I think, again, there's that medical purpose, right? What we do in the world of Parkinson's is we give a medicine to help restabilize dopamine levels. We give a medicine, maybe like anti-epilepsy medicines that dull the brain so that people don't shake. And these are not the only forms of therapy. I mean, we have to kind of change our mindset and stop looking at old therapies or therapies that are limiting us, because what ends up happening is, I'm going to go to an example who, again, I don't treat him, but we've seen him on TV and he's a public figure. But like Michael J. Fox, he has a tremor, and like anyone who's in his situation, he doesn't want a tremor in front of people, so he'll take the medicine to control symptoms. But with the dopamine therapies, we increase the amount that we take, and it peaks or builds up in our body. Now we're wiggling and we're having twisting and dyskinetic movements. And so, instead of over medicating to control symptoms, when we utilize things like Botox, we're already relaxing the muscle. If we relax the muscle, we're less dependent on these pills. So what I'm trying to focus on and spread the word is, let's use therapy appropriately and with multiple ways of getting to the source of the problem without depending on our old school world of pills, pills, pills.
I have one more question. Does Botox only treat the symptoms, or does it do anything to cure the disease?
I think that's a great question. Now, it does not cure the disease state for any condition it's being utilized for. So, like even with migraines, it doesn't cure migraines. It reduces the severity of the muscle spasms, the muscle contractions. From what my experience has been, again, for 3 months at a time, it helps stabilize and it manages symptoms that people are dealing with. But I'll tell you something very unique is, again, I've been seeing people for decades, and when I'm injecting Botox, and I've been doing it very particularly, since 2017, 2018, that these patients who've been coming in for tremor and rigidity of the muscles of their, whether it's their hands or their legs, when we've been injecting them regularly every 3 to 4 months, these people are still on low levels of Parkinson's medicines. Like, they are not typically on the high doses that we see other people who progress with the disease state. So I'm not saying it's disease modifying, but it does have a way that we are using less and less dopamine meds, so that when people are advancing, they're already now getting side effects on these tablets of therapy, where those who've been getting Botox aren't, right? Because they're not getting those limitations from the therapy. So we are seeing that less patients are suffering from the side effects of typical Parkinson's therapy because they're getting Botox early on.
Dr. Sandeep Thakkar, as always, it's been a pleasure. I've learned so much. Every time I talk to you, I feel like I'm enlightened. Thank you so much for what you do. Thank you so much for sharing it with the world. I cannot wait for the next episode of the Caring Neurologist. I know everyone feels the way I do. I know how important this is. So thank you again for sharing all your knowledge with us, and please do say something to your audience, because I know they're looking forward to our fourth episode.
Yeah, well, today was a great discussion. I'm glad that we got to, have that kind of platform today to talk about how we're different and unique in caring for patients. Again, it's this mindset that I have and that my team has is let's keep pushing the envelope of discovery. Let's utilize therapies for more than what they're intended for. Let's not be limited. We're trying to be pioneers, but we're trying to be also educators. We're trying to be um, on a level that we can teach other doctors. I mean, I really believe that we have an opportunity to help the masses, and it does not have to be the old school way of tablet form medicine. We're in an opportunity with neurology to not just diagnose, but to really manage quality of life, and hopefully we'll have cures sooner than later. But I'm hoping that this podcast specifically spreads and disseminates properly to people who are in need of it.
Thank you so very much.
Thanks.